Virginia Garcia really developed out of a very creative and active time in the mid-70s where community activists and concerned individuals really came together to provide outreach and health care to a population that was not well served.
Everybody rallied around it because it really marked a change in the way healthcare worked for these families, which was very important here. They served this community in an important way.
I can only describe it as something out of the ordinary, this extraordinary movement, and we had, unlike other groups and other movements, we had a sharp focus.
Virginia Garcia has an exciting, rich history, and starting from a 3-car garage over the last 40 years has now grown to provide healthcare services to over 40,000 people in 16 different clinics across Washington and Yamhill counties.
It's human dignity, goal-oriented. That is Virginia Garcia today, and that's what it was back then.
Today, amazing, The clinic here, it's just like unbelievable. We never dreamed about that.
There's a commitment that Virginia Garcia has had around quality of care, around quality improvement and innovation, and developing programs like patient-centered primary care home so that there's a more complete system of care from diagnosis to treatment to providing the ongoing support that the patient needs. And that's true with our dental programs as they've developed, and even now to behavioral health services that we have on-site integrated into our programs. So there's been a core at the foundation of Virginia Garcia, which has been outreach into the community.
We started providing services in the camp probably 3 or 4 years after we opened the clinic, and it has been wonderful, having the mobile van, because our doctors can see the patients in there. There's more confidentiality. I mean, we have lab there, we have other things that we provide there, and so we connect them back to the community so that they know that there are people around them that can help them, because otherwise, you can be so isolated that you don't know what's going on around you.
The reason why Virginia Garcia really became an organization is in response to the death of Virginia Garcia, and her death was as much a result of a lack of a culturally competent approach to care to a population as it was just a lack of medical attention. That legacy of culturally competent care has continued from that time till today, where we have seen the communities that we serve have increased in diversity. Virginia Garcia has grown in its level of understanding these different cultures as the community has grown in their diversity.
Virginia Garcia exists and is here because there's a need. And if that need isn't met, we're going to meet it. We exist because of our community, and we exist to serve.
Virginia Garcia is a success story. It's to the whole community. Virginia Garcia is something that can be done, and as we say in Spanish, si se puede. It is possible. We can do it.
Virginia Garcia's unique role in the community is one of providing high-quality, comprehensive primary care and being a center of healing and hope in the community.